Hello friends and welcome back to my channel. Do you know that high potassium level in your blood could be life threatening? Hyperkalemia might not sound scary, but it can stop your heart if left untreated. Let's talk about one of the most dangerous electrolyte imbalances, hyperkalemia. So in this video we will break down what hyperkalemia is, why it happens and how to recognize the symptoms and the best ways to treat it. I'm Disha and I'm working in nursing profession. Let's get into it. So in my previous video we have discussed about the normal values of potassium. So normal serum potassium level is 3.5 to 5 milliequivalent per liter. So when we call it hyperkalemia, when serum potassium level greater than 5 milliequivalent per liter, we call it hyperkalemia. It is less common than hypokalemia, but it usually very dangerous. What are the causes and contributing factors for hyperkalemia? So there will be increased potassium intake. So when potassium intake will increase? When we eat too many potassium rich food like bananas, oranges, spinach, potatoes, and potassium supplements. And second is the IV potassium administration. Rapid or excessive infusion of potassium containing IV fluids that can lead to excess potassium level in the blood. Then renal failure. So renal failure, what it can lead that will decrease the potassium excretion. So kidney dysfunctions, kidneys are responsible for excreting most of the body potassium. So impaired kidney functions can lead to potassium buildup, maybe because of chronic or acute kidney injury or kidney disease. Some of the medications are there that will reduce the potassium excretion, like potassium sparing diuretics, ACE inhibitors, and angiotensin receptor blockers like NSAIDs, that is the non-steroidal anti-inflammatory drugs, and trimethoprim. Hormonal disorders like Addison's disease, that is the adrenal insufficiency, and hypoaldosteronism. Aldosteronism. Then potassium shift out of the cell. So, when there is any cell injury or breakdown, when cell breaks down, potassium is released into the bloodstream. It may be because of any burns or severe trauma or hemolysis, that is the destruction of the red blood cells. Then, if the patient will have any metabolic issues like metabolic acidosis, insulin deficiency, or hypoosmolar states like hyperglycemia. So, these are the conditions when the patient potassium will go out of the cells. Now we will see the what are the sign and symptoms. So if you will see the neuromuscular symptoms, in that patient will have the muscle weakness that often starts in the legs and progress towards the trunks and arms. Then tingling or numbness like paresthesia, pinning or needle-like sensation in the hands, feet, or around the mouth. Muscle cramps or spasm patient will have. Then flaccid paralysis that occurs in severe cases and that can cause complete muscle weakness, or sometimes it can lead to the paralysis. Then patient can have the drowsiness, patient's blood pressure will reduce. In if we'll see in the cardiac symptoms, patient will have the palpitations, that is the feeling of irregular or rapid heartbeat, bradycardia, that is the slow heart rate. Then sometimes patient can have the skipped heartbeat, that can be that we call it arrhythmias. Then patient can have the cardiac arrest in case of severe hyperkalemia, that can be the life threatening arrhythmias patient can have. Then ECG changes we will see. So in ECG changes we will see peaked T wave, then widened QRS complex, flattened P wave. In GI we will see the nausea, vomiting, abdominal cramping, and diarrhea. In journal symptoms, we can see the fatigue, confusion, and weakness. Patient can have the oliguria, that is the uh, absence of urine. Some of the very Warning symptoms: in severe hyperkalemia, patient can have the muscle weakness or paralysis, bradycardia, arrhythmias, or sometimes sudden loss of consciousness. That may be because of the cardiac arrest. So there is one mnemonics related to hyperkalemia, symptoms of hyperkalemia, murder. So M stands for muscle cramp, U stands for urine abnormalities, R stands for respiratory distress, D stands for decreased cardiac contractility, E stands for ECG changes or EKG changes, electrical changes in the heart, then R stands for reflexes. Patient can have diminished reflexes. Now, how we can manage? What are the medical management for this situation? So, in non-acute situations, we can restrict the dietary intake of potassium, potassium-containing medications that may correct the imbalance. Then, administration of oral or by retention edema. And in severe cases, if serum potassium level are very much elevated, it may be necessary to administer IV calcium gluconate. So, calcium gluconate or calcium chloride we can give to the patient. In that calcium gluconate 10 ml of 10% solution over 5 to 10 minutes, and the purpose for this is the it will stabilize the cardiac membrane and reduce the risk of arrhythmias. Then the shift off, and we have to monitor the blood pressure of the patient. Then other than this, we can give the insulin and glucose to the patient. That will increase the out of potassium into the cells by stimulating the sodium potassium ATPase. Then beta agonist we can give to the patient, and sodium bicarbonate also we can give. So it will help to correct the acidosis and shift the potassium into the cells. Then we can remove the excessive potassium, like diuretics we can give to the patient. And in severe cases, we can go for a hemodialysis. If the potassium level is 6.5 to more than 6.5 to 7 milliequivalent per liter, and it can cause the severe life-threatening ECG changes or renal failure patient will have. Now we will see the nursing management. So patients at risk for potassium excess need to be identified and closely monitored for signs of hyperkalemia. We have to continuously monitor like muscle weakness, paralysis, dysrhythmias. All these signs we have to closely monitor so that we can prevent the cardiac arrest. Then nurse should monitor intake output, observe the signs of paralysis, arrhythmias. Potassium serum level should be monitored properly, as well as the blood urea nitrogen, creatinine, glucose, arterial blood gas values. We can find out the acidosis or alkalosis. It should be monitored properly. Then what are the interventions we can do? Like we need to store the normal potassium balance, then eliminate the potassium administration, then increase potassium excretion. That for that we can give the diuretics like Lasix we can give, then KXL8 we can give to the patient, then infuse glucose and insulin, because they will increase the excessive potassium into the cells. Then cardiac functions we have to monitor for arrhythmias and blood pressure changes in the patient. So this is all about today's video. So if you will find this video helpful, make sure to hit the like button and subscribe for more medical content. Let me know in the comment if you have any question or topic you would like me to cover next. Thanks for watching. Stay informed, stay healthy, and I will see you in the next video.